Rest assured, you're not going to walk around with erection for 8 hours. That'll be exceedingly inconvenient, right? Heads up, these are some hard questions on erectile dysfunction. I won't go soft on you. Or maybe you are asking for a friend. Hi, I'm Dr. Tan. I'm the Medical Director at Dr. Tan Medical Center in Novena Medical Center. I've been in private practice for the past 15 years, focusing mainly on men's health. So what is men's health, you might say? The best summary I've ever heard is basically we're the men's gynae. So we take care of everything from sexual health, including things like erectile dysfunction, premature ejaculation, circumcisions, all the way to fertility problems and prostate issues. So the question is, can ED be cured? The answer to the question is another question, which is, what is the cause of the erectile dysfunction or ED? So if the cause is a very benign cause, for example, an acute psychological stress or side effect from a medication that the patient is taking, then yes, we obviously can be cured because we just need to take away these factors. However, for the vast majority of patients, right, the cause of erectile dysfunction or ED is actually a reduction in the blood flow to the penis. And a lot of this is actually caused by chronic diseases like diabetes and high blood pressure and high cholesterol. And since these diseases cannot be cured, then by definition, the erectile dysfunction also cannot be cured. Before we even talk about the treatment options for erectile dysfunction, we have to talk about getting proper diagnosis. That's what you need to see a doctor for. You need to find out the cause of the erectile dysfunction, because not everything we should just throw pills at and hope that something happens. So first, find out the cause. Second, treat any underlying causes. If there's a reduction in the level of serum testosterone, get that fixed first. If it's a problem with obesity and overweight, get your doctor to help you with a medical weight loss program first. Then we move on to the actual treatments of erectile dysfunction, of which there are quite a few. From the least invasive, these are just tablets. We'll get into more detail later. And then slightly more invasive would be penile injections. And then even more invasive would be surgical penile implants. Somewhere in between would be this new treatment called electroshock therapy, which is to open up the blood vessels in the penis. So let's go back to pills for treating erectile dysfunction. Why are they so popular? You know, they're easy, they're convenient, they're painless, and honestly, they're really quite effective and really quite reliable. Right now, there are actually 4 different pills out there to treat erectile dysfunction. There's the blue pill, orange pill, pink pill, and then there's a white pill. All of them are slightly different. Their onset of effect, you can see effect as quick as 15 minutes, some take about half an hour or longer. Their duration of effect, some would last for 8 hours, some will last for up to 36 hours. When I say this to my patients, the usual reaction I get is, 8 hours? Because I'm happy. Clap along if you feel like a room without a roof. Rest assured, you're not going to walk around with erection for 8 hours. That'll be exceedingly inconvenient, right? Pills for erectile dysfunction are a little bit different from, let's say, sleeping pills. So if you're going to pop a sleeping pill, you better be lying in bed, right? Because you don't want to be driving and then fall asleep. Highly dangerous. You pop a pill for erectile dysfunction, you're not going to just get an erection. You're still going to need sexual stimulation. So after taking the pill, honestly, you don't need to be in the bedroom. You can go for your nice dinner, get back home, and when you're stimulated, then you get your erection. So pills with a shorter duration of action, like 4 hours or 8 hours, this becomes a very important point, or even a point of stress for a lot of patients. So in order to improve spontaneity, right, there are pills that duration of action is actually 36 hours. So you're basically ready for that 36 hours. Does taking erectile dysfunction medicines cause heart attacks? So this was a very big concern when these medicines were first launched in the 1980s. What happened at that time that caused this concern was all these men who were probably a little bit more advanced in age, who already had heart problems, who had erectile dysfunction all their lives, suddenly were now empowered to yet again live the lifestyle that they want. And sometimes they would, shall we say, put themselves in scenarios which were overly exciting. And it's because of these scenarios that their heart function couldn't take it, and that's why they got a heart attack. So it wasn't the pills that caused the heart problems, it was the pills empowering the men to be in a situation that caused their heart problems. I love that question. Okay, so will people develop an addiction or dependence to erectile dysfunction tablets? The answer is no, they will not. You'll never be dependent on it, you'll never be addicted to it. The reason people get this wrong impression is because they do not address the underlying cause. For example, a patient has diabetes. He doesn't control his diabetes, so his blood vessels gets more and more blocked. So his erectile dysfunction gets worse and worse. So he ends up needing a higher and higher dose of the erectile dysfunction medicine to achieve an erection. In his mind, he might be thinking, look, I'm getting addicted to this medicine. I keep needing more and more of it. But the truth is, it's because his diabetes is not controlled. This really emphasizes the point why it's so important to see a doctor for erectile dysfunction issues, get properly diagnosed, get the underlying cause controlled, rather than just self-medicating with such medications.
Very nice!
So if you found this interesting and you want to see more, please like, share, hit that subscribe button, and if you have any more questions, even harder questions, leave it in the comment sections below, and I will try my best to get back to you as soon as possible.
DKSH, the #1 in market expansion services.